Sir, irrespective of the bleed, all the ulcer patients with H. pylori infection should be offered eradication therapy. Not only those with bleed alone.
Eradication in your opinion, what do you recommend?
Normally we give 14 days of PPI together with clarithromycin and amoxicillin. That would be the results of clarithromycin, amoxicillin and PPI are better than clarithromycin, than PPI, amoxicillin and tinidazole therapy.
Patients with NACID induced ulcer bleeding, is there a role to eradicate Helicobacter pylori in them?
Ideally, we should be testing their H. pylori, and if positive, they should be eradicated. In the presence of GI bleed, the percentage, the positivity of H. pylori is reduced. But as a philosophy, our country, the whatever statistics is there, 80% of patients are infected with H. pylori. So test and treat is one hypothesis which possibly is applicable for Western world. But I feel that instead of testing and treating, all the patients with ulcer should receive H. pylori therapy, because the combination of NSAID and H. pylori is, and the chances of recurrence are there.
I think there could be a lot of discussion on H. pylori and ulcers, because H. pyloris can be normal commensals in the GIT, including the stomach.
Yes.
And there is no clear-cut evidence to suggest the cause and effect relationship between H. pylori and ulcers. My practical point over here is that the tolerance of these three drugs for a period of 2 weeks.
But sorry?
The tolerance of these three drugs which you give for H. pylori infection for a long period of 2 weeks, particularly amoxicillin, particularly metronidazole and others, most of these guys have some gastritis or loose motion and so on, and their compliance to complete the treatment for 2 weeks is rather too long. Isn't there any shorter therapy or some newer therapies coming up wherein you could reduce this therapy for a shorter period of time?
Basically, surprisingly, we see that patients, those who are taking the kit for H. pylori, have not shown much adverse effects. I don't know, but probably I think the dose of amoxicillin which is given is 750 BD rather than 2 grams. So that could be one reason. So surprisingly, the patients have not shown, and they don't, because we've been writing almost every day 4 or 5 prescriptions, but majority of the patients, they tolerate it well. As of now, I don't know of a combination drug, because this H. pylori is little submucosal, resistant to treatment, so, and difficult to eradicate. So that's why presently these are the combinations which are there. And the third thing is, it is a well established fact that H. pylori is associated with ulcer. So it's not that it is been basically documented in various studies that there is a strong association of H. pylori. There are 4 diseases which are associated with H. pylori. One is duodenal ulcer disease, second is gastric malignancy, third is malt lymphoma, and fourth is gastric ulcer. So these 4 diseases are strongly associated with H. pylori. The other things are there were associations of H. pylori with cardiovascular disease, with so many other things. Those are probably not evidence based.
Sir, surgery is the last resort. In how much percentage it is needed and how is the outcome?
I would say that we get around say 150 to 200 patients of GI bleed in a year, because since we started contributing our data to ISG task force, in last year we started it and we have more than 200 patients. I don't remember offering surgery in more than 2 or 3 patients. So the percentage requirement of surgery is quite less because of the effective endoscopic treatment. And the surgery, of course, delay in surgery can sometimes also cause the problem. But I would say effective PPI, endoscopic treatment, angiographic treatment have left very few patients, those who would undergo surgical intervention. Because if the endoscopic treatment fails, you have another endoscopy to be done. If that also fails, then you have an option of intervention, angiographic embolization versus surgery. At a center, if angiography is not there, they can be offered surgical intervention.
Thank you so much, sir.
Thank you.